I'm Natalie.
Hi, Natalie.
I'm going to be your nurse today.
Oh,
and
great.
I saw you're breastfeeding.
Oh, yeah.
So I just want to go over a couple of tips with you and some information regarding breastfeeding, how to
sure.
make it more successful for
Sure.
you. When babies eat more often, moms make more breast milk. The way to do this is directly putting baby onto the breast more frequently.
Oh, okay.
Whenever the baby shows cues, feeding cues, and even if the breasts are not drained, the milk supply might drop. So we want to make sure we're emptying those breasts.
Okay.
Early formula feeding, even a small amount, can also decrease your milk supply.
Oh, okay.
Okay, so we want to feed baby 8 to 10 times at least a day, around the clock. Nighttime feedings build up your milk supply, and this helps. You nap during the day helps able to feed baby at night.
I can.
Right. And learning hand expression. Have you learned about manual hand expression?
No, not at all.
This also helps with breastfeeding. Can I show you how to do it?
Yeah, sure.
So you're going to put your thumb and your index finger on the breast, like the baby's mouth should be on the breast.
Okay.
You're going to push back to the breastbone
Okay.
and gently compress forward, and you can rotate throughout the breast just like this.
Okay.
Okay.
Should I see a lot coming?
Now, it might not be coming out directly right away.
A whole lot.
But let's try it this way. So
Okay.
we push back to the breastbone and your fingers stay in this
Okay.
place.
So out here.
Correct.
Okay.
Push
Like-
back
okay.
and gently compress forward.
Oh.
Great
oh.
job.
Okay. I can see. All right. And I can rotate.
And you might have to stimulate for a little bit in order to see something.
Oh,
Very good.
All right. Okay.
We can also use a pump if need be. If something happens where you and your baby have to get separated, we'd like to do hand expression, and if we have to use a pump, we can go over how to use that.
Okay.
Okay. Moms who learn more about how to breastfeed and how to avoid common problems are more successful. So these following tips will help with that. You want to only give breast milk. Formula might lower your milk supply and put you at risk for engorgement.
Oh, I don't want to be engorged.
Avoid pacifiers. Pacifiers can hide feeding cues and give baby a false sense of fullness.
Oh, okay.
Okay, so babies who use pacifiers eat less. This will also lower your milk supply and put you at risk again for breast pain and
That's
engorgement.
right. That's what the other lactation consultant said. If the baby is sucking on the pacifier, they're not sucking on the breast, and so then I'm not making
Exactly.
Okay.
Another tip would be to avoid bottle nipples. If the baby needs a supplement, your nurse can show you how to feed baby without using the bottle nipples, such as cup feeding, spoon feeding, supplementation nursing system, and syringe feeding.
Oh, okay. That's interesting. Wow, I've never seen that before.
Okay. And when you go home, these are the reasons to call your doctor, including not enough wet or dirty diapers, if your breasts do not soften with feeds after day 3 and 4. These are numbers and resources that you can call, including the St. Agnes drop-in line. Okay, and the baby should see the doctor within 2 to 4 days after discharge. And this is information regarding collection and storage of breast milk.
All right.
All right.
Awesome. Thanks so much.
You're welcome.